Hello and welcome back to my channel. So we had begun our discussion on the cranial cavity. So we were talking about the meninges of the brain and the dural folds of the brain in the part 1. In the part 2 we'll continue with the other two meninges of the brain, which are the arachnoid mater and the pia mater, and also talk about the nerve and blood supply as well as the venous drainage of the dura mater. Now before we get into arachnoid mater and pia mater, let's first talk about the epidural space. Now the epidural space exists around both the brain and the spinal cord, but it has significant differences in the both. So let's start by talking about the cranial epidural space. The cranial epidural space is the potential space between the calvaria and the outermost endosteal layer of the dura mater. Okay, so it's between the bone and the outer layer of the dura mater. In normal conditions, its height is 0, so that's why it's a potential space. But in pathological conditions, fluids such as blood can fill this place, such as epidural hematoma. This is when the bleeding occurs between the tough outer membrane covering the brain and the skull. The most common cause of the intracranial epidural hematoma is trauma, which is commonly a result from a blow to the side of the head, particularly in the pterion region, which overlies the middle meningeal artery. In this diagram, you can see an H-shaped suture. This is called the pterion, where the parietal and the frontal, sphenoid and the temporal bones come together. This is a relatively weak and thin area of the skull and is prone to damage. The middle meningeal artery, it has two branches, the anterior and the posterior. So the anterior branch of the middle meningeal artery courses through the pterion and can be a potential site of rupture. So the rupture of the middle meningeal artery causes fluid accumulation between the outer dural layer and the calvaria. This fluid mass or the hematome increases, brain compression occurs, and this requires evacuation of blood and occlusion of the bleeding vessels. Coming to the spinal epidural space. Now, the space between the dural layer and the vertebral wall is the spinal epidural space. And unlike the cranial epidural space, the spinal epidural space contains fat, vessels, nerves, and lymphatics, and is the site for the administration of local anesthetic. Okay, so the spinal epidural space between the dural and vertebral wall contains fat vessels, nerves and lymphatics and is the site for administration of the local anesthetic. Moving on to the arachnoid mater. The arachnoid mater is the middle thin, transparent, avascular, cobweb-like membrane. Arachnoid means spider web-like. So the arachnoid mater or the middle mater is a cobweb-like membrane which is closely applied to the dura. So it lines dura like an inner tube within the tire. You can see here it's closely adhering to the dura. It is bound to pia via arachnoid trabeculae, which are filaments spanning the subarachnoid space. The subarachnoid space between the arachnoid mater and the pia mater, which is filled with CSF. Now we have something called arachnoid granulations. These are small mushroom peck-shaped projections of arachnoid through the dura into the venous sinuses or venous lacunae, and their function is to return CSF to the venous system. Okay, so arachnoid granulations are projections of the arachnoid through the dura into the venous sinuses. Their function is to return CSF into the venous system. Now we have something called the subarachnoid cisterns, which are dilated portions of subarachnoid space located in regions where the brain contour changes and the arachnoid bridges over that space. Okay. Moving on to the last layer of the meninges, which is the pia mater. Now the pia literally translates to tender mother or the soft mother located under the subarachnoid space. It is the innermost, thin, vascular, delicate membrane which is intimately related to the brain and is permeable to water and solutes. So this is our pia mater. It's closely adherent to the brain, and it is the innermost thin vascular delicate membrane. It firmly adheres to the surface of the brain and spinal cord, following all of the brain's contours and outlines in the form of gyri and sulci, and cannot be dissected. So it's following all of its outlines as well. It blends with the epicranium of the cranial nerves. Like the dura mater, it is highly vascularized, with blood vessels perforating through the membrane to supply the underlying neural tissue. Now what we're trying to say is the cerebral arteries entering the substance of the brain carry a sheath of pia mater with them. Okay? And the perivascular space between the blood vessels and the pia mater is proposed to be part of a pseudolymphatic system for the brain. When the pia mater or the meninges of the brain become irritated and inflamed, the result is meningitis, which is often the result of a bacterial infection. The arachnoid and pia mater together are also called leptomeninges, which means slender membrane, unlike the dura mater, which is the tougher and thicker and harder membrane. Finally, let's come to the meningeal arteries. Now, as I told you, the dura is highly vascularized, okay? So we can think of it in this way. The dura mater is divided into the anterior, middle and the posterior sections, okay? So we can study the arteries under these sections. The anterior cranial fossa, the floor of the anterior cranial fossa is supplied by the anterior ethmoidal artery, okay? So the floor of the anterior cranial fossa is supplied by the anterior cranial artery. Then we have the middle meningeal artery. So it supplies 80% of the dura and most of the supratentorial dura except the floor of the anterior cranial fossa. Okay, so you can see it over here. This is the middle meningeal artery. It divides into an anterior and posterior branch and supplies most of the middle fossa of the dura. Okay, it is a branch of the maxillary artery in the infratemporal fossa which enters the skull through the foramen spinosum. Okay, so we had studied another branch of maxillary artery which supplies the dura, which was the accessory meningeal, but that entered through the foramen ovale. Middle meningeal enters through the foramen spinosum. Okay, it divides into an anterior and posterior branch. And as we have already studied, it is closely related to the pterion and may be the cause of epidural hematoma. Further, we have the accessory meningeal, which is a small branch of middle meningeal, passes via foramen ovale to supply the dura around the cavernous sinus. The posterior meningeal are usually branches from ascending pharyngeal, but can also come from occipital and vertebral arteries, and they enter through jugular foramen and they're limited to the posterior cranial fossa. So the arterial supply of the dura was mainly by anterior meningeal artery, which was a branch of ethmoidal, the middle meningeal artery, which supplied the middle cranial fossa, and the posterior meningeal, which supplied the posterior cranial fossa. Coming to the nerve supply. Now the sensory nerve supply to the dura is via all the three divisions of the trigeminal, the vagus nerve and the cervical nerves C1 and C2. So cranial nerve number 10, 5 and C1 and C2. And the dura is sensitive to stretching, which produces the sensation of headache. Okay, so I've summarized the nerves of the dura, but for easier understanding, we can see that the supratentorial dura mater is supplied by the small meningeal branches of trigeminal, and the infratentorial is supplied by the cervical nerves and the meningeal branches of the vagus. Coming to the venous drainage. Okay, so the meningeal veins are located between the dura and the skull and are small, and they follow the arteries and ultimately drain into the dural sinuses. Okay, they communicate with emissary, diploic and cerebral veins which also all of them basically drain into the dural venous sinuses, which ultimately goes and drains into the internal jugular vein. The middle meningeal vein communicates with the spinoparietal sinus and drains into the pterygoid plexus of veins in the infratemporal fossa directly or indirectly into the internal jugular vein. So we can know the venous drainage of the brain a bit more in detail when we study about the dural venous sinuses. So for now, this is it I have. So let's just quickly summarize what we have studied. We have studied about the cranial epidural space, which is a potential space. In case of an epidural hematoma, there is collection of blood between the dura mater and the calvaria, most commonly in the middle meningeal artery at the site of the pterion. We saw about the spinal epidural space. We saw about the arachnoid mater, which is a cobweb-like membrane. We saw about the arachnoid granulations and a bit about the subarachnoid space and how CSF is returned to the venous system. We saw about the pia mater and how it is the most thin vascular delicate membrane following all of brain's contours and outlines, and how the cerebral arteries entering the substance of the brain carry a sheath of pia mater with them. We read a little about meningitis, then we saw the arterial supply, the nerve supply, and the venous drainage of the meninges. So that's it for the meninges of the cranial cavity. In the next videos on the cranial cavity, I'll be meeting you to discuss about the dural venous sinuses and the most important cavernous sinus. So please stay tuned for more and subscribe to my channel. Thank you and have a good day.